Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to touch bases here with you today on moving teeth with a minimum amount of tooth contact. And I wanted to show you about several things. In this case, it's just loaded with different problems. It has a fused tooth. We got unusually large adenoid tissue, and they had a tongue thrust, and it's just stacked with problems in here. And how we did the case with as much lack of touching the teeth as we possibly could. Let nature do their part. So I'll try to stress that as we go through the cases here, the case. Now this, we've got movement of teeth, and the bone moves with the teeth. That is so obvious, and yet it's still not thought about. I mean, we're going to bring these teeth down to here, and we're going to put a headgear on here and pick up these teeth back in the back here, and kind of reduce the vertical dimension of the face. As little contact as we can. Now we've got a crowded situation and a class 2 situation going on too. In other words, we're going to have to move this jaw forward a little bit, and we'll bring these teeth back, and we're going in here and send him in to get these 4 permanent second bicuspids out and the deciduous second molars out. You would not want to start on a case like this, but this is what pediatric dentists have to start thinking about, and it is ridiculous that pediatric dentists don't do more of their orthodontic work, but this is what goes on here. Now these teeth will come down and close the bite, and we'll put a headgear in which is going to kind of pick up these teeth on the side as we bring these down in contact, and we'll eliminate the second bicuspids here. He has a fused tooth in there. This is just loaded with problems. Now on this side, we're going to do the same thing. Take these out. This tooth right here is a lateral and a central are joined together, and we use them, and they fit in there perfectly fine, and you won't even notice it as we finish the case. Okay, looking at it from the just looking at the upper teeth, we got crowded in here, and we're going to eliminate teeth back in here. But you watch the way we fill this face out, and we're going to broaden the face in that respect right there. Now this is the lower arch, and these are 2 teeth that are fused together, and we'll just bracket or bond something on here, and he's got a tongue thrust, so we had to put something here with these little fingers going back to break the tongue thrust habit. And if there's anything else that go wrong with this case, that young man seemed to have it all, but it worked out great. Now let's go. Here is the lower jaw. You see, it's not out with the upper jaw here. We're going to bring these teeth back, bring this forward in this area, so you'll see that more or less change as we get through with it. Now this is after he's been in here and it's closed down. The bite was open further than that. And there is in there, we've already got the teeth together in this part, so the vertical dimension of the face is still real good, and no problem. You're about the same. You've got the 3 different areas of the facial structure there that are the same. Now we use an occipital headgear right here pulled out, and you have a deal coming around this side, and then you have a burr crossing in here. But we've moved the pull back here, so we're actually elevating the posterior teeth and not the anterior teeth, though we have a contact between the two centrals in the front with this occipital headgear with a spur in front of the teeth. Now here is the just the pictures of the facial structure, and this is the huge adenoid tissue. If you look here, I'm going to erase that so you can see the adenoid tissue there, and that's blocking this airway, and he's apparently put his finger or thumb or something in the mouth. I don't know how he quite opened it up that much, and we're going to move the teeth, and the bone goes with the teeth, and that's what I want to stress. You don't pull the teeth down here by themselves. Their bone comes with the teeth, and that does that on the anterior up here, where it's got very little pressure against the teeth right here. Now, if you get out here and start moving them forward, you got to put a lip bumper in to run interference for them. Now you can widen the arches out. The cheeks have a little force in there, and you can widen that out without a whole bunch of the stuff. Then we can take a large arch wire and widen it if we need to. Here we just widen it with a palatal separator. And this is after we got the teeth down, and you see we've got a retainer in here holding this in place. Now there is the adenoid tissue, and you can see where it is blocking his airway down to the little place. And so we sent him in and got this adenoid tissue removed like that. And now the adenoid tissue is gone in this area. And look at the added airway. So you got all these things you're dealing with this one particular young man, and a lot of this starts out when he's young, and you carry it along for several years sometime before you can finish. And we got through this one, I think, in about 5 years, or maybe 4 years, or less than that. All right, let's go on to another picture here. Now, here is the starting of these X-rays, the Panorex X-ray. I think this is number 1, and you take this and you look at the situation. I mean, these cuspids have no room to go in, and if you're familiar with this follicular movement of the teeth, that's where this follicle around the tooth bumps up against other teeth, and it won't move the tooth, it won't eat into the tooth, but it'll just go into the bone structure. And you see the follicles around these cuspids. You see them down here. Now, we want this tooth to come back here, so we're going to eliminate everything through this spot right here. Just take these out. Now this tooth will move back. We'll bring this tooth down in this area. This removing this will bring this tooth will move back, and we'll bring the cuspid right into that area. We won't lose much profile that way. These wisdom teeth are already forming here, and we made sure that was happening before we started. And I think he was able to keep the wisdom teeth. Now let's go and look at the second deal. And we put a palatal separator in here. It's not a very plain, but there's a screw thing in here going against these teeth. And we're widening this upper arch out, and we do that before we extract the teeth in here, and we get that out. Now we've widened the upper arch out. It's time we will come in and send somebody in to get these teeth removed. And then the first bicuspid will come back, the cuspid will come down, And these are the fused teeth right here. We just have 3 teeth down here. And we had a little tongue thrust problem, so we're going to put these little fingers on these teeth. Now here, let's go back and look at this again. Now here we take these teeth out, and this is 320 of 86 right here. And let's see how much time in here. And this is, looks like 522 of 86. That's number 4. Look where these teeth have gone to. This is the follicular movement of the teeth. Just watch that tooth right here. Just watch this tooth, and watch, well, any of these down here. Watch what moves. I'm going to back it up now. And you see where they are? See this bicuspid in here? We just took this out, and this tooth moved. The follicle had a lot to do with that movement of that tooth. Now here we are just a few months later. This tooth is spreading over. It's pushing this one back in this direction. This one is made room in here, and these two, see these follicular movement of the teeth. And this is something I want people to understand. You let nature do as much as you can in here. We took the teeth out and gave them room, and the follicular movement of the teeth brings these teeth in line. Now let's look at another period here. This is 5 of 86, I believe, and here it is 3 of 87, and these teeth are back in place. They're coming in. Now we come in and join that. Now we've got wisdom teeth back here, you see, all the way around. And so we knew we had plenty to bring from the back to fill up the space down here. And these 2 fused teeth right in this area, 2 teeth that are grown together. And we use them, just put a bracket on them, and we put 1 bracket on those teeth and move them into place. And these, we had the tongue thrust device on them. And try to break that habit. You got to get him breathing correctly, and you have to get him functioning every way correctly if possible. And this is number 6 X-ray. Now we're lining the teeth up. And number 7 is 10 of 88. And we started this back, I think, in 86. And everything's lined up. The wisdom teeth now have room. And if he grows any, move this out. I don't have a 10th, 11th X-ray here, but I think the guy got these permanent teeth into place, the wisdom teeth. So here is number 8, and we're just about to finish the case up. It's age 13-7, and this is 89, and we started in 86, if I believe. Now here's number 9, and this is 90, and the wisdom teeth have a pretty clear path to come in, and I'm pretty sure we saved those wisdom teeth and brought the teeth down like that. And you can look at this case, and I'll tell you, you can't tell that teeth are extracted, anything as far as the bone structure is concerned. And we brought the face out. Now I'm just going to go through the mechanical stuff here and show you. We put the teeth together up here. We used a soft wire here, and that's that fused tooth right there. We separated the palate, and I've cut that thing off. And then we took these teeth out up here, the first bicuspids. Now the cuspid will come in here. There's the palatal separator. After we cut it off, I took it out, put it on the model, kind of show you how we widen that out. Now there's the fused tooth. I got a bracket on it to the tongue thrust fingers there, pulling that out. Now we've finishing up again in 1887, and we're bringing the teeth into place with as little contact and taking advantage of nature's movement with these follicular pressures on the teeth. And so here's that fused tooth again down here. Watch, we'll turn that tooth, we'll push in here, pull it out, the tongue pressure coming right in here. And that's the second molars on the lower. Now this is the headgear that we used, and it's the arms of this were cut off so that it's picking these teeth up as we bring this down. And we hooked this little point underneath here, but it's just keeping these from going any further down. And we're using that occipital type headgear in that. Now, if you can study this case and you can do this, then there's no reason you shouldn't try. And this started, I'm sorry I said 86, it was 85 when we started. And this over here is 90 something. So this is about 5 years in between doing this. And it went from this all came down. You see it's in here. The teeth didn't pull them out of the bone or anything. They had the thumb or whatever's going in here and the adenoid tissue stopped his breathing, and that helped get that natural thing back. And if we got him breathing through his nose, we could stop the tongue thrust. Here is 4 of 90, and that's 6 of 85. So this is about 5 years that we worked on this young man. But that's what we got at the end. And it has changed his whole life of this person. And this case alone, if you could study it and learn how to do this, that's what I want, is just good orthodontics. There's no way you can do some case like this with these plastic frames around there and get this to happen. It just doesn't do. You need to learn how to bend the wire, and you need to learn how to look and see ahead of time what's fixing to take place in these cases. And this is a super case like that. Then you say, well, we extracted teeth here. This is going to shrivel up. Look how big it is. In other words, you can make this whatever you want. We got his tongue working up in here now where it wasn't over here. The adenoid tissue breathing, and the lower jaw, we had to widen it out, and the upper jaw too. So this is the finished product. And now look at these 2 fused teeth. We just put them in. I will guarantee you that probably he'll go to the dentist and they won't even realize he's got fused teeth in there. And we took this out to take, but look at the size. The 6-year molars are brought up into the space, and this is widened out, and he's got room for the wisdom teeth. And there he is, and here's the final picture of finishing this. The vertical height of the face is good, and this is a changed person. And you can do this type of work. And that's what my objective is, not how much of it you can do, just learn how to do really good orthodontics. I'm going to say goodbye. I want you to join our group and subscribe to our channel. And I'm going to say farewell for the for the time being. I hope I'll be back for more, and we'll stop this. Goodbye.